that burning feeling that you may feel in your chest after you eat certain foods. It may also be worse at night when you're lying down. It's acid reflux. And in this week's Your Community Health with Arnott Health, a local doctor talks to WENY's Renata Steele about what causes it and how to treat it.
Hello and welcome to Your Community Health. I'm Renata Steele with WENY News. I'm once again joined by Dr. Dipesh Patel, a third-year resident here at Arnott Health. And this week our health topic is acid reflux. Many people deal with this, but for people who are maybe unfamiliar, what exactly is acid reflux, Dr. Patel?
Acid reflux is the acid in your stomach. It can come up into your esophagus, which is your food pipe, and this causes irritation kind of throughout the day and at night for some patients.
And so this is a little bit different than, say, like just heartburn that a lot of people get occasionally.
So heartburn and acid reflux are essentially the same thing, but heartburn we try to use it less frequently, just periodic episodes, and acid reflux or GERD is kind of your chronic issues.
I see. And now, why is acid reflux something to be concerned about or that you would need to have medical attention to deal with?
So it's dangerous because the acid is very strong, and as it comes up in the esophagus, it irritates the lining. This can cause a host of different issues. It can cause irritation of the lining, which can lead to ulcer formation. It can cause strictures, which can make it difficult to swallow, painful to swallow food and drinks. It can also cause ulcers in the stomach as well. And one of the long-term consequences is something called Barrett's esophagus. This is a precancerous issue, and that's one of the main reasons we treat acid reflux.
I see. And now, how is something like acid reflux diagnosed?
Well, it's diagnosed based on symptoms, so we ask how frequently you get the heartburn symptoms, what causes it. We try and avoid trigger foods, nicotine, alcohol, chocolates, tomato-based foods. These all aggravate it. You want to make sure you have a good weight loss. Excess weight can put pressure on your esophagus, which can worsen your symptoms.
Okay, and now what are some of the other treatment options?
So you have medication options. You have antacids, so Tums, which people often take. That kind of helps mask the symptoms at the time. You have proton pump inhibitors, which decrease the amount of acid you have, and H2 blockers. So your doctor will put you on whichever medication is best for you.
Okay, and again, that's very important to talk to a doctor if you're having some of these symptoms, or if you do have acid reflux, work out a management and treatment plan.
Yep.
All right, well, thank you so much,
Thank
Dr.
you.
Patel, and thank you for joining us. And as always, you can find more information on our website, WENY.com. Thanks for joining us for this week's edition of Your Community Health.